So my name is Emma Linney and I'm a senior clinical psychologist at St James's Hospital, and one day a week is a day where I work specifically for the motor neuron disease service, providing emotional and psychology support to the patients and the staff. I suppose kind of thinking about anybody that receives a diagnosis of motor neuron disease, it's quite an emotional diagnosis to take on board. It's a really horrible disease to kind of get your head around. So pretty much from the point of diagnosis, there is a lot of emotional stuff going on for patients and their families and for the staff. Where I fit in is kind of once patients have received that diagnosis, if they're struggling to kind of come to terms with that, which is quite understandable and natural, I think anybody would, my role is there to kind of provide sometimes individual sessions to talk through maybe a patient's difficulties. So if someone comes and they're maybe feeling anxious about the diagnosis, or they're struggling with low mood, or kind of accepting and getting their head around certain aspects of the illness, then I'm kind of there to, where possible, offer that one-to-one support to them. Often, but not always, patients can have sort of changes in their thinking skills. We call it cognition, but that's kind of things to do with their memory, some of their language skills, their thinking, their organisation, their behaviour. And so part of my role is also to kind of think about that and do sometimes specific assessments around that, so that we can ensure if a patient is having issues in one of those areas, that we can tailor our work as a team, not just for me, but as a team, we can tailor our work so that we're communicating and supporting that patient in a way that best fits their needs. So what I would really be hoping for from a new Rob Burrows Centre for Motor Neuron Disease would be a space where staff can feel comfortable and empowered and have the accessibility and space that they need to work well together and feel empowered. And I think if they have that space, then that reflects on them and therefore patient care. My hope from this centre would be that we would be a kind of leading centre to drive forward care for patients with motor neuron disease and really improve the quality of care and experience that they have through what is a really difficult illness to have.